my name is Rebecca Gordon. We're going to be inserting an IV today, and so this is going to be my patient. And when I walk into the room, I'm going to perform hand hygiene for 10 to 15 seconds. And so, alright, first off we're going to check our patient, so we're going to use two identifiers. So Mr. Armageddon, what is your name and date of birth? And he's going to tell me his name and date of birth, and I'm going to check his wristband, just to double check. And then I'm going to check my doctor's order, make sure that we've got the right meds, right dosage, right route, time, all the quick checks. And then I'm going to inspect the bag. Normally it wouldn't be spiked, but since it's already spiked, we're going to leave it. So we're going to check the bag for any leaks, any damages, if there's any like floaties in it or something. So this is okay. So now we can go ahead and spike the bag, and what we do, we take the cap off, and that's sterile, so we can't touch it, and we're going to put it in there and spike it, and it's going to kind of click, and then we're ready to hang out, and our tubing is clamped. And so then we're going to take our protective cap off, we're going to prime our tubing, and then we're going to put it back on just to make sure that there's no air bubbles or anything that could possibly cause an air embolus or anything. We're going to set it there because we're going to use it later. Alright, so we checked everything, patient's doing okay, so next we're going to take an alcohol swab. Or, nope, first we're going to open our packaging, so we're going to open our packaging. That way it's ready to go when we need it. So, let's open. Alright, so this is our saline, we've got all the equipment that we need, got tape already, alcohol swabs, our Tegaderm, our catheter, and now we're going to perform hand hygiene once again for 10 to 15 seconds, and we're going to make sure that the patient's doing okay and that he's not. We're going to make sure that we're going to inform him of what's going to happen. We're going to put an IV in you today, sir, and first we're going to select the vein. So I'm going to palpate and I'm going to look. This one feels pretty good, so this is the one I'm going to use. Undo the band, and now we can go ahead, perform hand hygiene. Alright, and then we can get ready to actually put the catheter in. So, alright, so now we're going to put our clean gloves on. This is a clean procedure. And while we're doing this, we're going to be talking to the patient, asking him if he knows about the side effects that's going to be happening. We're going to inform him about the medicine, make sure he knows why he's taking it, and if he has any concerns, to come and tell us, because we want to make him better. Alright, so now we are ready to go ahead and put the IV in. So first we're going to take an alcohol swab. We're going to go up and down for 15 seconds and go back and forth on the IV site that we're going to choose. And now we can dispose of that. So now we're ready to take our catheter out. And so we're going to go in. I would have applied my tourniquet first before I had taken the catheter out. So now that he's ready to go, we're going to kind of pull down a little bit on his arm so we can stabilize the vein. We're going to go in at a 10 to 30 degree angle initially. And so we're going to go in, and once we feel like we've hit that vein, we're going to level it out to about 5. And we're going to push the catheter in and pull the needle out at the same time until the catheter is all the way in. And then we can dispose of the needle, and now our catheter is in. So now we're going to stabilize it. I'm going to take our flush We're going to flush 2 to 3 milliliters. And we'll have seen blood return too, so we know that it's in there. Alright, now that that's all good, we're going to take our tubing, take the cap off, put our tubing on while we're stabilizing it with our non-dominant hand. Put it on there. Now we can take our tape. Alright, lay one across the top. And then we're going to take our Tegaderm. I'm going to start peeling it off. This is going to be the part that we put on, and we're going to make sure it's below the hub. We're going to make sure we smooth it all out, make sure everything's all good. Nice and smooth. Then we can take off the top layer. And while we're doing that, we're going to take it and smooth it all around the edges. Make sure it's on there nice and secure. And I'm going to release the tourniquet. I'm going to dispose of that. And now we can turn our IVs on to whatever drips per minute we want, which would have been told by the doctor's order, and we would have checked on our Mars. So that is on, and we've already primed it. So we're going to check for drops, make sure everything's all good. And then we're going to assess the patient, make sure that he's not feeling any tingling, that has good circulation, that there's no redness, no edema, that there's no secretions of any kind, no blood coming out. Then when we're all done, we can dispose of our garbage. So that's disposed of, and we can take our gloves off, wash our hands, and now we're going to provide patient safety. So we're going to put his bed rails up, lower his bed all the way down to the ground. We're going to make sure the call light's in reach, and we're going to make sure that he has all of his personal items there in case he wants anything. I'm going to offer him if he needs anything. I'm going to be checking you back in a little bit. Just holler if you need anything. Use your call light. And so then I'm going to document the time, insertion, what medication I gave him, how he tolerated it, the route, IV site, all that. And now I am able to go ahead and leave. So